Enter.
Oh, good morning, everybody. Welcome. Be Connected has been putting this symposium together for the last couple of months, and I appreciate the job they do and the professionalism with which they display and the way they help our veterans. So congratulations to them on this symposium. What has changed since then is the Secretary of the Veterans Administration has issued a advisory that he would like to have 38,000 homeless veterans housed by the end of this calendar year. Sounds like a lot, doesn't it? Okay, that seems to me to be the estimate of the number of homeless veterans in the country as a whole. So I'm going to cover homelessness and how we deal with it in Mohave County, or how my organization does it with it. So on this slide, you'll say, what do you see in this scene? Okay, and this scene reminds me of riding the trolley in New Orleans, if you've ever done that. And there, when I saw this, the last time I was in New Orleans, they said they had eliminated homelessness among veterans in New Orleans. And there's only, if you go to the next slide, what don't you see here? Next slide, okay. This is what it looked like underneath this one bridge that is near the museum down there, the World War II museum, okay? And they said there were no homeless people there. So homeless people are usually invisible to the general public. Okay, there's a lot of organizations and agencies and different resources available who really care about it, but to the general public, all they see is a problem. They don't see anything they can do about it. So if we could go to the next slide. Okay, what happened to these people and why are they homeless? I'm sure if you go back and look at their high school yearbooks, you will see none of them had written in there that they wanted to be homeless, begging on the streets for a living and looking for help. So something happened to them along the way. And in a veteran's case, those of you that are veterans and are helping veterans know that there's some things that our veterans have seen that nobody should ever have to see. And that's just one of the issues. Mental health is an issue. Physical health is an issue. And then right now we're running into a problem with homelessness with many of our veterans who are from the Vietnam era, okay? They've got that 20-year pension. That 20-year pension, the cost of living has not caught up to the cost of living that they receive, and they just don't have enough money, and they're out there trying to decide, do they pay the rent, or do they get their prescriptions, or do they put gas in the car? Okay, and they're living day to day, not paycheck to paycheck, and they're barely making it. And a lot of them are out there in the desert in our area in different places. So in Mohave County, there's 30,000 homeless veterans. 50% of them are 65 or older. 70% are 55 or older. So we're starting to run into the physical difficulties that come along with aging. So this is what happened to them. There's many different reasons they're out there. And we have a lot of great people up there, and we have a lot of great people around the state that can figure out what happened to them and the help that they need. Next slide, please. Okay. Arizona, we have a problem. Okay, what can you do to help? Okay, and in the picture says, I'm confused. No, wait, maybe I'm not confused. Nope, I'm confused. We are confused, but you can't go out on as an individual and make a difference. You can, but it's dangerous for you out there because a lot of our homeless people have mental issues, and they are prone to attacking and physical danger. So what I'm suggesting is, if you're going out there, give the resources to the people that have the experience, the know-how, the training, the knowledge to help our homeless people. Next slide, please. What can you do on your own? Look for advice from experts. There's help out there, support, advice, guidance, assistance. There's organizations you can talk to. So look for the advice from the experts. Next slide, please. Okay. Ask the experts what they bring to the solution to the problem. And it takes a village to solve homelessness, okay? You just, one organization, the VA, and I was listening to the presentation yesterday, and Jennifer Gutowski from Tucson and Steve Sanders, I believe it is, from Prescott, both said the same thing. The VA can't do it on their own. Nobody can do it on their own. We need to work as a village with everybody participating in their own way. It doesn't matter who gets the credit for getting that homeless person off the street. It matters that the homeless person is off the street. So it's getting the village to agree. The VA is the lead, and there's no doubt about it. Okay. And working with them is important as anything else is working with any other organization. So next slide, please. Okay, what is available in your neck of the woods for resources? You have local government, county government, state government, and federal government. And let me tell you how this particular foursome has helped the Jerry Ambrose Veterans Council. Okay, we started out 11 years ago as we had like 12 bucks in the bank. Okay, and we were just helping individuals. Okay, and then there was never a stand down in Mohave County. And then I got conned into doing a stand down. And this is where my eyes really started to open. Okay, the mayor of Bullhead City at the time, Jack Hakem, wanted this stand down done. So we did that, and we looked at it, and we brought everybody in that we could agency wise. We had weekly meetings. We had over 40 different resources on our first one. Okay, but it was done because of the local government in Bullhead City mayor getting into it, and in the support of the county government as well through a community development block grant for other things. The state government has helped us recently, and the federal government. Actually, the COVID crisis has helped our organization get resources because there's a lot of money out there. The HUD, working through our director, Wanda Wright at the Arizona Department of Veteran Services, Arizona Department of Housing, and the governor's office, along with the city of Kingman. Now you get all these different levels of government there. It's really fun to work with. Okay, but you can do it. Okay, we got a $2 million grant to finish our building for 25 beds for transitional housing for homeless veterans through the Veterans Administration Grant Per Diem Program. Right now we have 25. We're working out of a hotel temporarily, but we have 25 in our program. We're full. And we just put 2 out to permanent housing yesterday, and 1 got a job yesterday. So the program works, but it works with the help of everybody, such as the Continuum of Care, nonprofit organizations, large and small, law enforcement agencies, which is where a lot of our homeless veterans first make contact and somebody recognizes the fact that they have a need. The courts, Mohave County has 3 veterans treatment courts started in Lake Havasu City. We were there to help with that and push the issue. Then it went to Kingman, and this is the court we support the most because the vet resource team in Lake Havasu City really takes care of their court and their people down there. And then there's Bullhead City, which we help when they request it. So we help that group as well. The veterans treatment courts in Mohave County have a total recidivism rate of less than 5%. And when you consider that the national recidivism rate is at 80%, these veterans treatment courts, or if you don't have one in your town, fight for one because you really need it. There's people coming through these courts that are homeless, have mental issues, have funding issues, physical issues. The courts direct them to the resources that they need to get well. They're removing barriers. Medical facilities, talk to your social worker at the hospital. Okay, that social worker will know if somebody coming through needs help, and they will call you. And we have a good relationship with our hospital in Kingman, the Kingman Regional Medical Center. Housing authorities are great. They in Mohave County, they are the actual managers for the HUD VASH program through the VA's HUD VASH program, and they work well together. Okay, and we're part of that team along with other organizations such as Nation's Finest and Catholic Charities, the Cornerstone Mission. There's just a lot of resources out there. You got to dig and find them. I've been here 11 years and I'm still digging and I'm still finding them out there. So don't get discouraged. Just keep plugging at it. Housing authorities, and we got one problem in La Paz, they don't even have a housing authority. So you look at it that way. In order to get the VASH, HUD-VASH vouchers, you have to really participate in the point-in-time survey, which happens once a year, usually in January. Look into it. It will bring a lot to you. And when I first started this, we had 25 vouchers in Mohave County. We now have 250 because not only the VA and our organization, but other organizations are out there counting the homeless people. And that's how you get the vouchers. You show the need, you get the deed, okay? Transportation networks. We got a problem here in Mohave County because you cannot get on a bus and go from Kingman to Lake Havasu City or Lake Havasu City to Bullhead or Bullhead to Kingman. So I understand there's some programs in the works for transportation. Our organization will provide transportation. You just call us up and we'll do that here in Mohave County. Talk to your employers. A lot of employers out there have programs where they can put in a veteran for a journeyman program or an apprenticeship program, or that they have veterans in their workforce that have trouble getting to work because they don't have a car. Employers are a good resource to help you with the homeless veterans population, and a lot of them will even donate you money, okay, which is the #1 thing that we need out there. And your educational institutions, okay? Is there anything that you can add to this list? Next slide, please. The Jerry Ambrose Veterans Council, Mohave County, okay, we have a direct veterans assistance line, 928-377-2487. Information is 928-716-3001. Okay, and then we have a navigator's email. We got many ways to contact us. Follow us on Facebook. The numbers are up there for the National Veterans Crisis Line. Okay, be connected. We are currently updating the Mohave County resource, making sure that all the numbers and links and everything is correct because these things tend to change. Next slide, please. I believe that ending homelessness requires all of us, public and private sectors, faith and business communities, mayors, city councils, county administrators, nonprofit service providers and advocates, people from urban, suburban, rural, and tribal areas, and most importantly, those who are proximate to the issue, people who have themselves experienced the tragedies of homelessness. Ending homelessness also requires to do some soul searching. How do we take care of one another? Are we our brother's keeper? What kind of society do we want to build together? I strongly urge that you support those that have the necessary skills, training, and experience, and allow them to take the lead, as there is danger in going it alone out there. And I want you to think about the homeless people there, but for the grace of God, go I. So I appreciate your attention, and I will try to answer any of your questions to the best of my ability.
All right, Pat, great job with your presentation. We have a question from Maria Esposito, and she asks, what about mental health services? No mention.
Well, mental health is one of the main things we do, but there's people out there that this is where you go to the experienced people. You go to your mental health, you go to your Southwest Behavioral, you go to your veterans vet centers. Okay, we have a vet center out of Lake Havasu City over there that helps. Okay, the VA they help with PTSD and mental health issues. Okay, there's a lot of help available out there, but there's not a lot of people working in these fields, and we need to support our education system to provide social workers that can help with this. Okay, we have people in our program that need to really see somebody once a week, and they're getting appointments two months apart because there's just nobody there to provide the services. Okay, and I know everybody's having the same problems with employees and getting them, but this is a very critical area. And if you know anybody looking for a good job that'll be there for the rest of their lives, this is it.
Thank you for that, Pat. It doesn't look like we have any more. Let's see. It doesn't look like we have any more questions. We have some comments for you. Dee says that you are doing great work in the community, and then Stacy Lee says she really looks forward to working with you, and she can't wait to change lives here. So
Well, I got to watch out for her because she hit the ground running. Okay. So,
thank you, Pat. And
okay.
If you don't have anything else, we'll go ahead and move it on to Jocelyn.
Thanks, Elena. All right. So Pat really said what this whole session is about. You know, it really takes a village if we're going to end veteran homelessness. Pat's from the north part of the state. I am down here in the southern part, Pima County. I am a social worker at the homeless clinic at the Southern Arizona VA. As Pat mentioned, the VA is very committed to ending veteran homelessness, but we can't do it alone. So what I was going to talk about today was how in our continuum of care how we collaborate with our community partners through our veteran case conferencing in order to reduce the number of veterans experiencing homelessness in Pima County. Next slide, please. So I just wanted to give out, in case folks didn't know, in Arizona, we do have 3 continuums of care. What are they? The continuum of care, we have one in Maricopa County, one in Tucson, Pima County, and then we have what's called the balance of state continuum care. These continuums include it's like a coalition of community and faith-based organizations, government entities, businesses, and individuals who are all committed to the mission of ending homelessness and addressing other issues related to homelessness in our community. So as I mentioned, today I'm going to be talking about what's going on in the Tucson Pima County COC and how we're working together to get more veterans housed in our community. Next slide. So one of the ways that we do that is each continuum of care has what's called a by name list. And for each continuum of care, that by name list includes every person that we know of in that continuum that's experiencing homelessness, right? So we have outreach workers, agencies, folks who are coming in contact with people who are experiencing homelessness, and assessing them for providing housing or homeless services. Those folks get put on the by name list. So we know when someone's homeless, we know when they've been referred to an agency to get housing, and we will know when they are housed, and we can remove them from our list and know that we've been successful. How we do that in Tucson Pima County really depends a lot on our case conferencing. So our case conferencing is a meeting where all homeless service providers come to meet and talk about the people that they're serving who are experiencing homelessness. In our community, we have it broken down by population. So we have a case conferencing that's specifically for veterans. So in that case conferencing, we look at what we call the top 30 veterans experiencing homelessness. Those are the veterans who've been homeless the longest in our community. We look at what barriers they're facing, systemic barriers related to their housing. And then we brainstorm and come up with solutions for how we're going to get that person housed. Whether they're having issues with a legal background, maybe they don't have money for deposit, maybe they have a companion animal and they need somebody to write a letter for them so they can get into their housing. Unfortunately, a lot of the barriers we're seeing now is there just isn't enough housing in our community to get folks housed quickly. But basically, we really do focus on problem solving. We don't, put the blame on the veteran for them being homeless. We understand that, the root of homelessness is really related to a lack of housing, affordable housing, that if there was enough affordable housing in our community, that people would have a home. So, we look at what barriers there are and go from there. So it really gives us an opportunity to improve collaboration amongst those who come to our case conferencing, the different providers and agencies, and an opportunity to share resources within our community. Next slide, please. So basically, our case conferencing, our goal is we want to house more veterans and faster. Next slide, please. And these are the folks who are attending our case conferencing. We have community outreach workers, housing navigators. We have all of our permanent supportive housing providers. So in our community, that's VASH, which is the VA's Section 8 housing program. We have some of our health homes, or those agencies that receive access dollars to provide mental health services like COPE and community partners. The city of Tucson attends the case conferencing, our family services, Old Pueblo Community Services, and the Southern Arizona AIDS Foundation. These are all agencies that provide permanent supportive housing in our community. We also, and they all serve veterans, right? So the VA has a certain, we have those veterans that we can serve, but there are veterans outside of the VA's parameters that we're unable to serve. And so those veterans are able to get referrals to other community agencies for the housing that they need. And then we all come together to talk about how we can really help get them housed. We have all of our rapid rehousing providers, including Compass Affordable Housing, the City of Tucson, Community Bridges, Catholic Community Services, Primavera, Sullivan Jackson Employment Center, and Pima County. Our SSVF provider, which is Project Action for Veterans, again, they can serve a good number of the veterans who come through our system, but there are those veterans they can't serve who may be over income for the supportive services for veteran families grant. They may have some other legal issues that prevent them from being able to be served through that program. But then we have all of these other community partners who can jump in and help serve those veterans who kind of fall through the cracks of VA funding. We also have our GPD providers, which in our community is Old Pueblo Community Services, or OPCS, and Esperanza and Escalante. And then we also have our HMIS lead, which is the Homeless Management Information System. This is the database that holds all of our information related to folks experiencing homelessness. Next slide, please. So again, the purpose of these meetings is really around problem solving, networking, collaboration. What's not the purpose is looking at our data and trying to clean it up, or updates that just say, oh yes, we're working with that person, don't worry about it, we got them. No, we're going to ask questions. We're going to say, wow, this person was referred to you 2 months ago. What's getting in their way of getting the housing they need? So we really try to stay veteran focused in these meetings. Next slide, please. So again, we want to reduce the length of time between referral to a housing program and actually getting into housing. We want to increase our agency collaboration. In these meetings, there's a lot of accountability. So if we're working with a veteran, we identify that barrier, and then we say, who's going to take care of the next step? Who's going to be the one to reach out to the landlord? Who's going to be the one who's going to help connect this veteran to a payer source to pay their deposit? That person gets assigned that task. And in our next meeting, we follow up, hey, did you complete that task? So there's a lot of accountability in these meetings, which I think is part of its success. So, when someone says they're going to do something, we're all there to make sure that happens. We're going to identify all agencies and programs that can provide housing and other services for people experiencing chronic homelessness. And we're going to hope for 100% of follow-up on those tasks that were identified. Next slide, please. Our meetings are always a safe place to ask for help from one another. So we don't ever shame anyone. If someone didn't follow up on their task, we just, we offer assistance. We say, what can we do to help you follow through with this? Or do we have to have someone else do it? It's not a place to make people feel bad. It's really a place of support. We support the decisions that are made as a group and work to move changes forward as a team, and we're respectful of each other's opinions. I think that's one of the big values in this collaboration is we're all here for the same reason. We want to get our veterans housed, and we're all willing to do whatever it takes to get there. And we're also willing to say when, we didn't do what we needed to do, and then make a plan to get it done. Next slide, please. So again, folks come into the meeting. We identify that veteran by the HMIS number. We ask what action has been taken since our last meeting. We talk about if there are any other barriers. We record a new action step, and we talk about when do we think this veteran will be housed? By the end of this month, by the end of next month, next week, what is that date? We try to set a date so that we have something to work towards. And again, it's that level of accountability. Next slide. So back in January of 2020, our 3-month average housing placement rate was 14 per month. We really started up our case conferencing again and following the process that I just described to you. Since then, our average placement rate for veterans over the past 10 months has been 20 per month. And I really do think that case conferencing has a big thing, has been part of the impact there. I'll tell you that back in the heyday, we could house 50 or 60 people a month. But with housing the way that it is these days, it's been a big struggle. So while 20 may not be where we were years ago, it's a huge improvement from where we were just a year or two ago. So next slide. These are our coordinated entry access points. So for anyone who's experiencing homelessness in Pima County, they can reach out to these agencies either by phone or in person to schedule a time to meet with a case manager, get assessed, and get into our coordinated entry system and hopefully be referred for services. Next slide, please. Oh, no, just kidding. That's it. All right. Thank you.
Thank you, Jocelyn. I do have a couple questions for you. One of them is from Maria Esposito, and she said, do you have law enforcement involved in any of your committees?
So in our local continuum of care, we do have law enforcement involved in our committees. Our continuum has really been purposeful in identifying how our law enforcement can participate in our COC. So in our continuum, we have what's called an outreach list. And what that is the list of people who have been referred for housing, but we've been unable to find. And so in our continuum of care, our local law enforcement has a homeless outreach team, and that team gets that list. And as they encounter these folks in the street, they're able to connect them with those programs that they've been referred to. Good question.
Awesome. Thank you, Jocelyn. And then I just want to remind, we have Karen Charles is presenting next. I just wanted to remind everyone we have until 9:55 and it is currently 9:41. So if anyone else thinks of any questions, go ahead and put them in the chat box. And I will let Karen take this over.
Good morning, everyone. I'm Karen Charles. I'm the supervisor for the homeless program in Mohave County out of the Kingman VA clinic. So I want to share with you information about Northern Arizona's first project-based housing development for homeless veterans that we have here in Kingman. It's right down the street from our clinic, and it's called Kingman Veteran Villas. And I'll just refer to it as KVV going forward. Next slide. KVV was created through a collaboration between us, the VA, the Mohave County Housing Authority. Dave Wolf was the former director of the Housing Authority, and this was really one of his passions that he wanted to get accomplished before he retired, and he was able to do that. And also Adams Construction, they were the developer, and they are the project or the property manager. The Mayor of Kingman, Jen Miles, and community partners such as Pat Farrell, who was our first presenter here on the panel with the Jerry Ambrose Veteran Council. So our community in Mohave County is very rural. We do have 3 main cities, Kingman, Bullhead City, and Lake Havasu City. They're all very different. The population estimate for the entirety of Mohave County is about 218,000 people. We're very spread out. I think we're the second largest county next to Coconino in terms of square miles. We have about 25,000 total veterans in Mohave County. That could be larger now. I know Pat mentioned earlier 30,000 veterans, and that's not homeless veterans, that's just veterans in our county. And I see here's a link to Kingman Veteran Villas if you want to take a look at that. Next slide. So I wanted to quote the Veteran Affairs Secretary, Dennis McDonough. He said not very long ago that every person should have a home, every veteran should have a home. And this is exactly what we do under HUD-VASH for homeless veterans. HUD-VASH stands for the Department of Housing and Urban Development, VA Supportive Housing Program. And under HUD-VASH, we have a variety of services. We start out with an outreach social worker who helps identify and engage homeless veterans. She does an assessment, an individual assessment with the veteran, and kind of makes a determination about what would be best for the veteran, either admission to HUD-VASH if we have vouchers, or possibly offering them what we call diversion, which is services through some other type of program or community partner in the area. And veterans always have choices. We're very veteran centered, and we start where the veteran is and work from there. And we have we house veterans under a housing first model, which means that instead of requiring that a veteran be clean and sober, for example, before we house them, we try to get them into permanent housing quickly, and then we offer supportive services after. So our Mohave County Housing Authority offers the voucher, the housing voucher, and then we in HUD-VASH offer the wraparound services. And the ultimate goals are to house homeless veterans who qualify for the program, and then help them maintain stable housing. And once a veteran is on HUD-VASH, some of the services that we offer are social work case management, mental health and substance abuse treatment, nursing case management, peer support. And our peer support is a really interesting role. It needs to be a veteran, and a veteran who is in his or her own recovery from some type of substance abuse problem. We also have a housing specialist who is I'm so glad that we have her. She helps with or does much of the admission paperwork to VASH, helps veterans get their documents together for the Housing Authority. She also is a fantastic liaison for our Housing Authority, and we have a great relationship with them. We have an employment specialist who helps veterans, of course, who are seeking employment. He also is very skilled at helping them apply for different types of VA benefits and also Social Security disability, if that's the best course of action for the veteran. And we have a VASH nurse practitioner. Veterans can choose to see her. She serves as their primary care nurse practitioner. There's also 4 primary care teams here at the Kingman Clinic and more down in Lake Havasu. We have a clinic in Lake Havasu also. And the veterans, again, always have choices. They can choose who their primary care provider is, either through the VA or if they have some other type of health insurance access or even Medicare, they can always choose to see a provider outside of the VA too. Next slide.
Sorry, Karen, and I just wanted to remind you, we have about 7 or 8 minutes left.
Okay, I will step it up. So Kingman Veteran Villas is the first project-based housing development for our whole region. And my main project involvement was finding veterans who qualify and developing a process for admission in collaboration with our housing authority, KVV property manager, which is Adams Construction, and my staff. The biggest challenge that we had, and you can advance the slide. The biggest challenge that we had was that the eligibility guidelines for KVV were set more strict than they are for VASH. So we asked for a variance with the Department of Housing to try to ease those eligibility guidelines. Our first request was denied, and then I gathered data from a pool of veterans, and just took a look at what would cause these veterans to be ineligible for KVV based on the current eligibility guidelines, and how many would be eligible if each of those guidelines was loosened. And ultimately, the Department of Housing did ease or relax some of those guidelines, which helped us to be able to easily fill the remaining units with eligible homeless veterans. And we did this all during a pandemic, and my staff really did a great job. And we did a really good job too, working together with the Housing Authority and Adams Construction on this. Also, I reached out to pretty much anybody and everybody throughout the Navajix region and asked them to send us referrals on veterans who might qualify or might be interested in living at KVV, and got a really good response. Next slide. So because of KVV, we've housed 48 more homeless veterans and their families in Mohave County, in addition to the almost 150 we already house under VASH throughout the county. We have the biggest program in Navajix. We have the most vouchers. Really proud of the work that we do. And many veterans have expressed joy and gratitude about receiving this housing. My favorite one is the last one, that it's given me dignity. That is exactly what we want to hear. We want veterans to have dignity and feel like we respect them, and want to also convey that to them. Next slide. I thought you might be interested in seeing what they look like. This is the exterior before it was completely finished. Right there next to the garage, they put some decorative stone, just very tastefully done. It's very nice. So it's two units there connected by the garage. Next slide. And here's looking into the interior from the front door. And if you go to the right there down the hall, there's 2 bedrooms and a bath. And there is a backyard also with a fence. A lot of our vets have animals. It's very important to many of them. Yes, and next slide. So here's my contact info. If anyone has any questions or would like to follow up later, since we're running out of time, you could feel free to contact me. I added the Homeless Veterans Hotline, which any homeless veteran can call to get be connected with care from the VA in whatever region they're located. And this is the Veterans Crisis Line. If any veteran is feeling suicidal or just wants to talk, this is the number to call. So thank you.
Thank you so much, Karen. Okay, sorry, we just had a question about these being paid by vouchers, but it looks like that question was answered by Rebecca in the chat.
Becca's our housing specialist, so she knows what she's talking about.
Awesome. Okay, does anyone else have any questions you'd like to put? See, someone says, how many of these units are planned?
I don't know what you mean by planned.
I'm sorry, Anel, can you please elaborate a little bit?
There, as far as I know, they are not planning to build any more units. There's 48 units. And again, we house about 150 veterans throughout Mohave County, just in the community. So, you know, that's also an option too.
Awesome, thank you so much. I would like to say thank you to all of our presenters. You guys did great. I know you have a few more today, so good luck with everything. There's a couple links in the chat box. If anyone has seen those, there's one for Headstrong, which is a free mental health service. If you want to go ahead and get that link. And yeah, that about wraps this up unless anyone has any more questions, comments. If not, we are good to go. Thank you, everybody.
Thank you.